Hello everyone, welcome to the EFOS podcast. I'm Hoi Kyu, the head of design at EFOS. It is a true honor to have the opportunity to speak with the Honourable Dr. Leong today. Dr. Leong is a distinguished surgeon and politician. He represented the medical functional constituency in the Legislative Council from 1988 to 2000 and held prominent positions, notably the chairman of the Hospital Authority from 2002 to 2004, non-official member of the Executive Council of Hong Kong from 2005 to 2012, and the chairman of the Council of the University of Hong Kong from 2009 to 2015. Dr. Leong has also led numerous committees, including the Hong Kong Kidney Foundation, the Hong Kong AIDS Foundation, and the Elderly Commission. Dr. Leong, thank you for joining us.
I didn't realize I have done all these things. My pleasure.
Yeah, how are you doing today?
Okay, yes.
That's good to hear. So, firstly, I would like to start off by asking a few questions related to your
You do whatever you like.
Yeah. Could you share with us? So I read your book, The Triumph of Rationality.
I use that book for other people to do barbecues.
And was there like an idea or like what inspired you to write about this book and your life story?
Well, I don't like to write an autobiography. I rather write things which I've done for the society, which improves the society.
I see.
And that's exactly the reason behind why I wrote this book. The title is very specific. The title is, it's actually about rationality. Because everything starts off being rational. If one is rational, then you may face a lot of opposition initially, but ultimately, rationality prevails.
Yeah.
And at the end of the day, therefore, you may succeed. So that's exactly why I wrote this book. But the last chapter of this book is even more interesting.
Yeah.
Yes, I've done a lot of public duties for the society. But through all these, don't expect your name to be on the blast plate. You do this not because of you, not because of a name, but because you want to serve the society. Whether you got any honors on that, whether people recognize you on that, doesn't really matter. Because at the end of the day, the society benefits. So that's exactly what I wrote this book for.
Yeah, thank you. So what key message do you hope your readers gain after reading your book?
I've always believed that serving the society is everybody's prerogative. We are now in this society. We belong to this society. This society gives you all the honors and efforts and all that sort of thing, make you a person. It's right that you should really give back to the society. And giving back to society means to say that you're serving society. You don't ask for a benefit. You don't ask for a reward. You serve society in whatever way you like, so long as it actually, at the end of the day, really benefits the people of the society. That's exactly what it is.
So, first I would like to start off by asking a few questions. Like in your book, you start like in a very chronological order. So you start from your childhood and your upbringing. So could you tell us a bit about what growing up was like for you?
Okay, yes. Well, you realize that this is my alma mater. I graduated University of Hong Kong long time ago, well before you and all your parents are born. I graduated in 1962. Well, I mean, you probably would ask me, why do you want to take a medical profession? Well, I believe that looking after patients, helping patients is a way to serve the society. And I'm being influenced by my parents, who are basically doctors. I mean, incidentally, my father also graduated in the University of Hong Kong well long before 1938. So I think they influenced me.
I see.
They influenced me because I realized that facing patients, facing society, you're not treating a disease, you're treating people.
Yeah.
And the way they do it really influenced me a lot. Take an example. My father and my mother, for whatever reason, they were asked to serve Aberdeen. Now, back in 1938, Aberdeen is just a small fishing village. And he's the only doctor and the only person who speaks English. So he's a communicator between perhaps the fisher folks there the people there and the government. So, I mean, it takes up that sort of role other than just being a doctor. Doctors, in a way, they need to do whatever that's necessary to deal with the patients, deal with the people. As I mentioned in the book, I remember two very, very vivid occasions. One occasion is that in number 8 typhoon, a fisherfolk out in a boat is having a pregnancy and they're going to labor. Well, without second thought, he jumps into a sampan, go to the fishing boat and do the delivery. Now, it's dangerous because the boat is never steady. Go on to the sampan, you could easily roll over. So that's something which is very impressive to me. Second thing that I wrote in this book is that, Chinese are very superstitious. The first day of the New Year is supposed to be sacrosanct. You shouldn't see dead people. But as a doctor, what can you do? Somebody died in the boat on the first day of the New Year. You need to certify him dead. You need to give him a death certificate. He's got to do it. So you jump on the boat, go out there and certify the person dead. Now, nothing spectacular, but it only means one thing, that is what you are destined for. That is your duty. That is the way you serve the people, and you got to do it that way. So that, in a lot of ways, that influenced me to take up medicine as my profession.
Since you graduated here at HKU NBBS,
1962, long time ago.
Do you have any favorite memories of the time back then during when you were a medical student?
Well, I think there's a lot of memory of medical school, and I don't think the medical students nowadays have that sort of memory. One of the memory is that you're facing teachers and professors which are very demanding. Give you an example. In a physiology lecture, you are asked to test gastric acid. You got to test your own gastric acid, which means that you got to put a round tube into your own stomach, aspirate and test. Now, the funny thing is that some of the classmates doesn't want to do that. So they cut short the round tube and put it in their nose. I also remember another very interesting thing. You're supposed to do microbiology. You're going to look at the microscope and see whether your stool, your feces, has any bacteria. Has any worm, not bacteria. So once one of my classmates got not his own feces, but the feces of his cat. So he looked at the microscope and says, my God, some very exotic ovum. Asked the professor. And the professor got mad and said, look, something wrong with you. How can you have this sort of ovum? Those are interesting things that you see.
It sounds like medicine back then was a lot more
Well, those are days and that everybody is, I would say, a little bit tricky. Yes, very interesting. But that is life in medical school, and that is life that I enjoy.
I see. So why did you choose to specialize in surgery, specifically urology?
Well, in our days, there's no such thing as urology. Everybody is trained as a general surgeon.
I see.
You are trained to do craniotomy. You are trained to do amputation, anything to do surgical procedures. Well, I've been asked repeatedly, why do I take up surgery as my sort of career? Well, I believe that, surgeons want to get the root of things immediately. You see a patient with a bit of a abdominal problem, you want to know what that is. You want to treat it immediately. So surgery is the quickest way. You open them up and you find out, oh, it's appendicitis. Or you find out it's a carcinoma of the colon. So I'm that sort of character. I want to find out things immediately without dilly-dallying and think for a long time.
Straight to the
That
point.
is exactly why I thought surgery suits me. I'm one of these people who really wants to get to the root of things immediately.
I see. So when you were a trainee surgeon, what was the biggest challenge you faced?
Biggest challenge. Everything was a challenge. At that time, as even a very junior doctor, basically there are not that many senior staff. So you got to do almost everything without any support, without any supervision. I remember during the first appendicitis, I was told how to do it by the anesthetist. He actually told me, cut here. So I do that. But that's how we train ourselves. We train ourselves in two ways, really. First of all, there's a lot of clinical material. During my training days, we would be doing maybe 5, 6 appendicitis every evening, 2 or 3 bleeding stomach ulcers, 2 or 3 gallbladder infection. So it's a lot of clinical material, and it's because of all the clinical material, therefore you gain a lot of experience. Second thing is that you really sometimes have to be innovative. For example, 2 things that I actually mentioned in the book. We realized that people with cancer of the bladder, one of the way then was to take out the whole bladder. Now, once you take out the whole bladder, you end up having to have a stoma to pass out your urine. Now, for a lot of people, that is something they don't want to have. Urine coming from your tummy with a stoma, you got to wear a bag. They rather have no treatment. But then I thought, what can I do? I can think of ways to reconstruct a new bladder so that they can really pass urine the proper way to get rid of the taboo of having to wear a bag and having a hole in the tummy to pass urine. The Professor of Surgery and myself started to use the colon. We used a bit of the colon, fashion the bladder, and then join the urethra so they can pass urine that way. Now, it wasn't very satisfactory for a few reasons. As you probably know, the colon is a lot of mucus. So a lot of mucus come out, it will block the urethra. So there's a problem. Second is the bladder, the colon absorbs whatever acid in the urine. So the person ends up having to take bicarbonate to neutralize the acid. Furthermore, the colon is not a very contractive organ. So the urine pass is slow. So we thought, well, can we do something else? We need a hollow organ to form the bladder. Then the thought come to me and say, look, why can't we use a bit of the stomach? Stomach is thick wall, stomach contracts well, stomach produce acid rather than will not absorb acid. And producing acid may be good because it kills the bacteria. So you're going to have clean urine. So we do that. Now, we can't just do it on the patient. So we do it on dogs. So I became an expert in doing experimental surgery. So we did a lot of bladder replacement using the stomach in dogs. It has been successful. But it's hard life because at that time, there was nobody assisting you to look after your dogs. So every evening, I've got to finish whatever I do, perhaps attending social functions, go back to the animal lab to catheterize the dog. So I'm going to do that. And you realize that dogs will just pull the cat out if you put the cat in. So you're going to somehow sling them up so that they will not touch the catheter. So it's hard life, but it's interesting because at the end of the day, it's successful and you can apply in the human being. We did quite a few of those cases in human being. And the effect is that totally happened. Other people in the other part will use that. And very fortunately, because of all the research I did gave me an honor that the Royal College of Surgeons of England conferred on me a title of Honorary Professor. That was something I'm very proud of.
You flew over to the UK to receive that award, right?
Well, I mean, at those days, everybody goes to the UK for training, and everybody goes to the UK to get a fellowship. A fellowship means an attainment that you're now a specialist. So Hong Kong and UK is very closely related at those days when Hong Kong is still a British colony. Surgeons in Hong Kong are very close to the surgeons in Edinburgh and surgeons in England. And this relationship, especially with the surgeon in Edinburgh, has continued up to today. And they have helped us to build our college in Hong Kong, bring us up to an international standard.
So speaking about breakthroughs, I know that in 1969, you were a member of the surgical team in Queen Mary Hospital that performed the first ever kidney transplant.
That's interesting.
Yeah. What was that moment like for you?
Well, you see, we started off thinking that if you do a major surgery, and major surgery then means it may be a now surgery, you may end up having an acute renal failure. The kidney may stop function for a few days. And during those few days, urea start to climb up, water start to retain. You could get rid of it. So the first thing we did was that we obtained a first dialysis machine from the Rotary Club as an acute dialysis to tie the pain over for the first few days after surgery so that there would not be urea and creatine retention, water retention. Now, because of that, we extended it to chronic dialysis. We realized that there are people who have chronic renal failure and they need for dialysis to keep them alive. Now, that would mean to say they will have always stuck with the machine all the time. So at that time, I know that in the United States, they did the first kidney transplant in a twin. It's successful. A twin brother gave it to another twin brother. It's successful. We said, why can't we do it in the same way, not twins, but taking a kidney from, say, a dying person or immediately dead person and put it into the patient? Again, we don't want to do it immediately on human. We did it in dogs. It was successful, and therefore we said, well, look, why don't we try it in a human being? It was a long wait for the fact that you're going to obtain the kidney. Not everybody is willing to donate a kidney. Not all the relatives are open-minded enough to donate a kidney of a dying or immediate dead relative. So finally, in 1969, we broke through. We got a relative who's willing to donate her daughter who had a crash accident and you can't survive her. So we got the kidney into a kidney and it was successful. But it was quite a bit of headache because you see, you've got to realize that at this very sad moment, you're asking a relative to give you consent to take out an organ of a dying or dead person. When the relative said, look, doctor, I want to save my relative. I don't want you to take out the organ. So that is a very hard moment. And you realize that it's very difficult for a relative to say yes at that moment.
Yeah. Today, you're known as Golden Surgeon, Grand Bauhinia. So what do you think of this nickname?
Well, I don't know why they call me that. I don't know whether it's because my surgical skill is okay or because I charge too much. I don't know what's the reason, but I believe that is a good name and I serve it humbly. The media gave me that name.
Oh.
Yes.
So now we'll talk more about your experience in public service.
Okay.
So what inspired you to pursue public service in addition to your career?
Well, this is something I really want to tell medical students and young doctors. You see, doctors are fantastic in medicine and surgery. They're very concentrated. They are experts in doing their own field. But some of them, they only know their own field. They don't know outside their field. To me, that was my feeling. I want to learn something more than just surgery and medicine. And the only way that I can do that is if I broaden my mind, involved in other areas of society. So for involving in all these public services, it's really a chance for me to learn what the society really needs. The other thing that I must mention is that doctors are actually very useful in this public service. You know why? A patient comes to you, they tell you everything because you treat them. Sometimes they will tell you everything about their condition, their discomfort, their illnesses. But because they want to tell you everything, they also tell you their lifestyle. And having understand their lifestyle, then you understand what the society actually influence them. And a lot of times, their illnesses is due to the society's perhaps discrimination. So you understand the society more as a doctor. So I believe that doctors are perfect people to get involved in the public service to help the society.
That's good. Yeah. So in your book, you shared that back in 2002, you introduced a charging policy of 100 HKD for all attendances in A&E deemed non-emergencies. So could you talk about your experience proposing this healthcare reform?
Well, this is history. Very few people realize that the accident emergency department of public hospitals are continuously free since it's set up. You go to A&E department for whatever, even if you want to go there because you have a very headache, it's free, totally free. It's okay. That is exactly what a good public service should do. Because you realize in Hong Kong, the public service, medical service motto is nobody should be deprived of care because of lack of means. So even if you are very poor, you go to a public hospital, you get the best of care there at no charge or at a minimal charge. So that's exactly what the accident emergency department is. They don't charge any people. You just come in and they give you whatever is necessary for you. Now, that's fine. But the end result is that because of that, you get a lot of abuse. A lot of people coming to the air casualty or accident emergency department really are not emergencies. Because of that, the accident emergency department is overloaded. Because, yes, maybe 1/3 of the patients are really emergencies, they're traffic accidents, but the other 2/3 are just minor issues. They have a cold, they have a bit of stomach ache, they have headache, they go to the casualty because it's always free, it's always open. You always can see the doctor and get everything you want. Now, to me, that is a little bit of abuse. And the abuse is not just for the money, but the abuse is that you therefore delay the treatment of the real emergency patient. What do you do then? One of the thoughts I said is that, okay, let's say if we charge people the A&E, we will cut down the abuses. I brought along a team of legislators to see the public hospital A&E, and they were impressed because I'll tell you one incident. They were there, they realized that the whole A&E is filled with people. The number in the wall says that we are now seeing number 2 and you're number 702, so you're going to wait. A man came in, register. He told the nurses that, oh, I've got a bit of headache. I thought after that I wanted to I want to see the doctor. So the nurse told him, look, you're now 785. You got to wait for a few hours. It doesn't matter because I've got a friend up in the ward. I want to visit him. If my time comes, ring me. I'll come down now. You see, isn't that an abuse for accident emergency? So the legislators are all impressed that we really should charge the A&E. So that's how I started the whole idea.
Was it difficult getting it passed?
Oh, I'm surprised that it was very easy to get it passed because everyone support the issue. And in those days, whenever you do something which concerns money, there will be a lot of people coming out and put up slogan. I'm surprised there was no slogan on that night.
And do you think it achieved its aim, like the reform?
Well, I mean, yes, I started off by saying that we should charge $400.
Oh.
But the government then say, look, 200 is too much. So they low down to 100. 100 to a lot of people in Hong Kong is okay. So yes, the first few months, you cut down the real non-emergent patient. But after a few months, everybody come again because it's $100. They were successful initially, but as time goes on, a lot of people feel that $100 is still okay because they can come and see a doctor, do everything, even for minor issues. Paying $100 is okay.
So what do you think of the recent reform of raising it to 400 that's proposed next year?
I believe that raising money is okay, but I'm not. You see, what they're saying is that if you are really urgent, emergency, then it's free. If you are not urgent, they raise you up to $400. I think it's a little bit difficult to deal with because the person sitting there to do the triage, you are grade 1, you're grade 2, grade 3. It's very difficult to deal with. Some people come and say, I've got a severe tummy ache. Now, is he grade 1 or is he grade 3? If it's grade 1, you don't pay. If you grade 3, then you pay $400. Now, it's very hard and very taxing on the person who sits in a chair to do the triage.
I see. Yeah.
And you may end up having a lot of dispute, a lot of argument, and a lot of unhappy feelings in the A&E department.
That's a real dilemma.
Yeah, it's a dilemma. The principle is okay, but for the person who triage the people coming in, sometimes it's very difficult. I have tummy ache. I pretend I'm having severe tummy ache. How do you say that I'm not having a tummy ache?
Yeah. So, can you talk about your role in establishing the Hong Kong Academy of Medicine?
That's an interesting issue. I think we've got to go back again to history. You see, Hong Kong has always been following the British system. When we graduate, our curriculum is very closely related to the British system. Okay, when we graduate, I want to become a surgeon. How do you become a surgeon? Then, in the past. Well, you join a university unit, you get trained for a couple of years, you realize that I'm okay, I'm efficient enough. I go to UK to get a surgical fellowship, be it Edinburgh, be it England, or be it Ireland, or even Australia. You get a fellowship, you come back to Hong Kong and say, oh, I'm a surgeon. Are you really a surgeon? What proof do you have? The fellowship is only a member of a club. There's no structured training for you. You never had any structured training. You follow your professor, you do a lot of appendices, you do a lot of summer. You say, oh, I'm good enough. So I'll go take the fellowship. You come back, you claim to be a surgeon. But what are the criteria behind to prove that you really had that structured training? So that's point number one. The specialties that were the so-called specialists in Hong Kong never had a structured training. Okay, come 1997, we realized that Hong Kong is going to return to the motherland. You cannot therefore follow totally what you have in the UK. So you got to think of something yourself. So at that moment, I thought, well, look, why don't we take this opportunity to structure, to have a training program for all specialists on a structured basis. And that's behind the reason for the academy to form. Okay, every specialty, be it a neurologist, a nephrologist, a surgeon, an orthopedic surgeon, an ENT, an eye surgeon, would need a fixed number of years of training. Then you take some form of a test. And when you finish that test, you pass, then you are basically therefore a specialist. So that's the reason behind it. Now, to do that, to make sure that the society look at you and say, okay, you are a nephrologist. We have to use law to pass this. A law to say that, okay, we need 6 years. They see a number of years of training program. You need to take an exam and therefore pass it. So that's why I started to push for an academic medicine to have. You see, we cannot have laws for all the individual colleges. There are 16, 70 of them. How can you make laws for all of them? So why don't we make a law for an umbrella body? And under that umbrella body are all the different colleges. They will have the same training, they will have the same procedure, they will have the same structure, and at the same time they become a specialist.
I see.
So the academy is because of two reasons. One is that we need a structured training program. Secondly, is because we cannot follow the UK system totally.
I see. Could you share some insights from your experience advising on traditional Chinese medicine, regulations and standards in Hong Kong?
Well, that's a very interesting question. You see, you have to realize one thing. For the last 5,000 years, whether you are a royalty, a king, or whether you are an ordinary person or a pauper in China, the only thing you face is Chinese medicine. And these people are still alive because there must be some form of a good, useful issue in Chinese medicine. Okay, that's point number one. In Hong Kong, because we're all Chinese people, traditional Chinese medicine is always used. Every one of us, 飲涼茶 and all that sort of thing. But one thing, when the British took over Hong Kong in 1842, they control Hong Kong, right? They will control everything in Hong Kong except Chinese custom. They stop 中秋節. They say you cannot stop and say you cannot do a Chinese marriage procedure. You cannot stop a Chinese funeral procedure. Chinese medicine was not considered as a medicine. This was considered as a Chinese tradition. Therefore, it's not controlled. So for 100 years, Chinese medicine in Hong Kong was never controlled. Anybody who is a Chinese can claim that 我係中醫. You see? Okay, that's all right, except for two things. One, for the real 中醫, you have a disadvantage. I'm a real 中醫, you're not. We are all 中醫. We claim to be 中醫. Right?
Yeah.
So it's very unfair for the real trained traditional Chinese medical practitioner. More importantly, is that because you are not registered, if a patient comes and see you, give him medicine, you give him treatment, and something happened to the patient, there's no recourse. Because there's no registration, they come to you, you gave me medicine, I took the medicine, I dropped that tomorrow. Who am I to blame? You're not a registered person. Now, so on those two bases, I thought, well, look. Third thing is that come 1997, when the basic law says that after 1997, traditional Chinese medicine and Western medicine should be in par. So therefore, we must do something to ensure that traditional Chinese medicine are properly recognized. And that's what, because of that basis, I pushed them to register. But once you register, then you're properly recognized. Both you gain your reputation, you gain your status. Secondly, the patient, more importantly, gets recourse if something wrong with your treatment.
It's for the trust of the people.
It's both sides. It's for the real traditional Chinese medical to gain that I'm real. But the more important is to give the benefit of the public sees traditional medicine that they will be able to, they will get the real treatment, and if they don't get the real treatment, they will get a recourse.
So you chaired the hospital authority from 2002 to 2004. What was that experience like for you?
Well, I thought is fantastic. Because as an ordinary doctor, basically, if you look at management, I'm managing only 2 nurses and 2 secretaries. And suddenly, I'm asked to manage 8,000 people. So it's a big experience for me. As I mentioned just now, when I do all these public service, it's for my benefit. I learn the different aspects. Okay, if I happen to chair a meeting with doctors, I can always be over them, because perhaps I'm more experienced than they are. But once you chair, for example, the hospital authority, or once you chair the other different issues like the elderly commission, you're facing experts from other fields, which you know very little. So it's the way to learn. By learning that, you mean 2 things. You got to really read up the issue beforehand. You got to be thorough yourself, and then you got to listen to all their views. So to me, it's a real learning experience, and I've enjoyed that. Yes. The second issue about hospital authority is that I was totally involved in SARS then, and at that point in time, I was really very amazed and really very devoted to the medical profession and the healthcare profession. I mean, everybody was there out to try to search for the disease. Everybody is trying out there to do their best for those who suffered, who got the disease. And they will spend day and night in the hospital next to the patient without going home, without even considering their own health. So we're there with the patient. So I really take my hat off and salute to all the healthcare professionals there.
Yeah.
At the same time, I think Hong Kong did a very good thing. You see, in other parts of the world, there are people who just left the service because they said that they want to get involved. But in Hong Kong, we do not have a single person leave the service. They are all very dedicated to it. So I'm really impressed, and I really believe that, oh my God, this is what the healthcare profession should be. Dedicated, they even give up their own health. They're not afraid. They realize that they may get the infection, but they go forward. They do everything. Some never even go home because they do not want to carry the disease back to the family. A lot of them actually stay in the quarters, particularly we provide for them. Some of them actually go and stay in hotels.
It's really inspiring.
Very inspiring. I'm moved. Total dedication. Even the lowest rank, even the lowest rank, they will never go home there because they said, look, I don't know whether there's enough material for tomorrow. I want to be here to make sure that there's enough material before I go home. So there's total dedication, which I'm really, really respect.
Yeah. So during the SARS pandemic in 2003, what was the biggest challenge you faced during that?
The biggest challenge is very simple. We don't know what it is. We don't know what's the best treatment.
Everything was like a mystery.
Yeah, everything was a mystery. As they call it, it's a war. It's a battle without smoke. There was no gun smoke. But we don't know what it is. We're totally in the dark. I spent 100 days daily in the hospital authority headquarters analyzing the different issues with the staff, telling the staff what to do, what is the best way to do, how to protect themselves, and all that. So it's a fantastic experience. I don't think, seriously, any medical person would have this opportunity to go through such an issue, to learn.
Yeah. So you have been, I'll talk a bit more about elderly care.
Whatever you like, yes.
So you have been actively involved in elderly care and have spearheaded several initiatives in this area. So could you share with us some of the key initiatives you introduced, such as active aging and also the Elderly Academy?
Okay. I believe that, as I say, I want to learn from the society. I want everything that the society needs. And especially as a medical personnel, I want to get involved with other things than just pure medicine. That's why during my career, I've been very much involved in industrial health. You probably realize that, anti-smoking was one of the things that I pushed for very initiative to make laws on anti-smoking. I've looked at noise pollution. People who are involved in very noisy industry, they lose their hearing after a period of time. So what is the cause of that? I mean, it's because there's not enough protection. Both the employee and the employers doesn't realize the importance of doing that. Well, you don't lose your hearing immediately, but you lose your hearing 30 years later. By the time they're well retired. Now, how do you compensate that? At that point in time, there's a lot of considered pneumoconiosis. People who breathe in silicon, breathe in the asbestos, they get a slow progressive deterioration of lung. Again, you don't feel anything until maybe 30 years later. Then you suddenly becomes a respiratory inability. You can't breathe properly. You're going to walk around and carry a bottle of oxygen. Now, how do we prevent that? And how do we prevent that? How do you make sure that both the employer and the employee understand how to prevent? So I was involved in that. At the same time, somehow or the other, I came on the situation where AIDS, HIV, suddenly came into the scene. And as a medical personnel, I thought that's medicine.
So reflecting back on your career, what was the most memorable experience you had?
That's very difficult to define. I believe every single bit that I do is to me very memorable. Because as I said, I start off not trying to collect honors. I start off want to learn from society. So everything is memorable to me. And I must be glad and proud that everything I learn, I can contribute back to the society. That's the main thing. For example, we talk about at that point in time there were sudden influx of HIV/AIDS. I thought, as a medical personnel, AIDS is not actually medicine. AIDS is actually a social issue. But how do we tackle that in Hong Kong? I mean, everybody says, "Oh, AIDS, it will kill you." I remember once that there was a dentist who very openly said that he's got AIDS. I took him to lunch in the place, and I was asked to leave because there's discrimination. So I want to make the issue of telling people that AIDS is not something that you can get by just shaking your hands or eating in the same table. I want to educate the public that AIDS it's only caused by blood, by tissue secretion, and by mother-child infection. I want to tell people that you can easily prevent AIDS by having safe sex. So that is my involvement, and I believe that to a certain extent we got the message through. That people now realize that AIDS is. I mean, there are a lot of people walking around with HIV positive. They're taking medicine. They are living the same life as anybody else. They're doing the same work. They even have babies. So to me, yes, it is a challenge. But by involving in education, you end up giving a better society.
Yeah. So this is a big question. Throughout your career, you have been involved in so many different projects. So how do you balance?
Nosy.
How do you balance your different commitments?
Well, it's a matter of time and management. I have to say that I'm proud that while I'm involved in all these public services, I have not stopped my own professional practice. So I believe that is basically my thing, the professional practice. I want to keep it. I want to keep it simply because I want to be a surgeon. I want to continue being a surgeon. I want to keep the same practice. If you give that up for 2 years, your hand becomes, you can't do it anymore. So I have keep on. And I'm also very proud to say that while I'm doing all this public service, I've never refused to attend one meeting.
Wow.
I've always attended all the meetings that's necessary. And one thing I want to tell people is that chairing meetings are not easy. As I mentioned just now, when you chair meeting with people experts of different fields, you got to be well prepared. And the way to be well prepared is 3 ways. One, make sure you know the minutes of the last meetings. Before people start asking you things that they have discussed 5 meetings ago, you tell them, look, sorry, it's been decided 5 meetings ago. Second thing is you got to really study the scenario. And third thing is, most important, listen to the view of others and come out at the end of the day with your ideas, collecting all these views and come up with a solution. Yeah, I think that's a way to deal with meetings, to be able to lead a meeting, to be able to get an efficient meeting, to get result of a meeting.
I completely agree.
Yeah.
Like, if you don't review the previous minutes, you just kind of repeat the
A
same.
lot of people come to a meeting without forgetting what they have said before. They start asking questions which you have decided 5 meetings ago. And if you start going through that again, then you're wasting time. So you tell them, sorry, 5 meetings ago, we already decided on that. So move on.
So now I'll ask a few questions more related to ethics and also looking towards the future. So through an ethical perspective, which local healthcare challenges in Hong Kong do you find most pressing and warrants further attention?
Well, medical practice in Hong Kong started off with a very good motto. And the motto is that nobody should be devoid of care because of lack of means and because they have no money. This is very, very good. This is what the government should do. But unfortunately, people look at it and turn it around and say, no matter how rich you are, you can still use the public healthcare service, which is no basic minimum charge, to whatever you like. So therefore, Hong Kong healthcare situation is that you are a victim of your own success. Because so successful, everybody goes there, no matter whether you're a billionaire or you're a pauper, you get the same treatment, you get the same best of treatment. So therefore, more and more people come to the healthcare services. And therefore, as I mentioned, you are a victim of your own success. Now, that is something we want to think about, to say that, look, who are the people who really can utilize the totally free public health care? And what about those who can pay? And I believe those who can pay should pay more to support the service, to make sure that the service is efficient, so that those who really need the service, they get the service.
So, nowadays, AI and technology is increasingly becoming more integrated into healthcare.
Right.
So in what way do you think that AI and technology fits into or influences the patient or doctor?
I've always believed in 2 things. There's a Chinese saying, 水能載舟，亦能覆舟. That means water can float a boat, and it can also capsize a boat. Same thing with AI. AI is a fantastic thing to help us to do things. But we cannot totally depend on AI because it will make you fail. So I think that's very, very important. Second thing is that AI, if you use it to the extent that everybody uses AI, then AI actually takes over human being.
That's the big question.
Right?
When robots could they replace doctors?
Yes,
Even?
yes. So we should use AI with caution. We use AI to help ourselves to do what we want, but we should not depend totally on AI.
Right.
We should really use our own mind or brain to utilize AI to help us instead of utilize AI to take over us. I think the Chinese saying of 水能載舟亦能覆舟 is very, very succinct. Water can always float a boat, it can always sink a boat.
It's like two sides of a...
It's two sides of a coin.
Yeah. So speaking of technologies, from 2001 to 2010, you served as the chairman on the Council on Human Reproductive Technology. So what were the biggest ethical considerations of reproductive technologies that were being discussed?
Okay, technology today, scientific technology, they do everything. But you have to look at the ethics. Okay, when a couple, or when two persons, a male and a female or whatever, wants to have a child, there are so many ways they can do it. All right? If the man does not produce enough sperm, you can do artificial insemination. If the lady does not have a uterus, you can use a surrogate mother to do that. Fine. The two person or whatever is happy. They're going to produce a child. Let's think of the moral issue of the child. He or she comes to the world not of his wish, but the two of you just produce me. So I think the most important issue of that is how to protect the child. So in my mind, artificial insemination, scientific assisted reproduction is fantastic. You can do everything, but how do you protect the outcome of the child? Let's say, if a man does not have enough sperm and the lady uses artificial insemination, one fine day the man says, "Oh, this is not my child. Right? This is not my child. I don't want to take any responsibility." Now, the child is faultless. He comes to the world because you produce me. I don't want to come here. Take another example. If the mother doesn't want to carry the baby, they use the surrogate mother. If the child is born, the surrogate mother says, "I like the child, I want to take it back. I don't want to give it back to you." What is the outcome? Right? So all these are very important. The ethics is a morality, and the moral issue is that how do you protect the interests of the child?
Yeah, there's a lot to think about.
Oh, yes. So everybody says, "Oh, scientific assisted human reproduction is a scientific issue." Yes, it's a scientific issue, but the issue behind it is not scientific, it's a moral issue. And the most important thing is how to protect the moral interests of the child.
Right. So now we're moving on to the very last section, which is I want to talk more about your what you're doing these days. I know you're currently a radio show host on a program called 人生馬拉松, right? The Marathon of My Life.
Yeah, right.
On FM 104 every Saturday morning.
Oh, you're going to promote that for me. You will listen to it, I won't get fired. Yes.
You have been co-hosting it for almost around 10 years.
Oh, 15.
15, yes. Wow. So having interviewed so many guests and listened to their life stories, were there any guest experiences that deeply inspired you and you would like more people to know about?
Well, I think I took up this program after I finished with the elderly commission.
I see.
And they thought that, you see, life is just a marathon. That means to say, just like running marathon, you're going to finish. You can't stop midway. Also, sometimes you can run faster, sometimes you run slower. Sometimes you even run the wrong path, you're going to go back to the right path. Sometimes you might slightly injure yourself, but you still have to continue. That is what the principle of the whole program is like. To me, yes, life is something that you're going to finish, no matter what you do. There are times that you may be very depressed because of mental issue, because of love issue. There are times when you're unhappy because your business failed. There's a time, etc., that your health is so good that you're sick, but you still have to continue until the final end. This is the basic of the whole thing. Now, to me, by interviewing all these people with a different type of life, I interview people who are billionaires. I interview people who are important leaders of Hong Kong and the world. I interview people who are very low, ordinary grassroots people. People who just make tofu, fu yu. To me, learning from all these people, everybody has a way of living. And that really inspires people that, look, not everybody is born with a golden spoon. Some people are born with $5. They come to Hong Kong, join the uncle in a small little pawn shop or whatever, stay in the ground, and then now become the millionaire. So basically, it is telling people that, look, you got to think of the way to move forward. You want to make sure that you are committed to do things move forward, and then ultimately you're going to succeed. So that's basically the issue behind the whole thing.
For the guest experiences, is there like one person that really like is very memorable, that like one of the guests that were on the show?
Yeah, I think there are quite a few people. One of the things that really inspired me is actually the grassroots. I've interviewed a person who started off, husband and wife starting a shop that sells all sorts of odds and ends. It's now grown to a big enterprise. And I asked him, what was the reason behind all these? He said two things. He said he's totally served the customer. If you buy something for $2, he'll deliver it to your home.
Well, it's very
Yeah. He delivers home. Therefore, he gets the support, he gets the confidence of his customer, and therefore it goes from there. I mean, this is something that you have to tell the young people, tell the people that, look, don't despair because you don't succeed immediately. Keep on, concentrate, become innovative, think of a way. There's always a way to deal with things that will inspire your customer or whatever, and then ultimately you succeed.
Yeah, I'm a firm believer that we shouldn't give up. The process.
I've interviewed an elderly person who carved mahjong, in a small little basement underneath the staircase of a shop. It's fantastic. Everybody loses that technique anymore. Now he's changed into somebody who can produce mahjong in the factory.
That's really impressive.
Yep, very impressive.
So this is a fun question. Since you're a radio show host, any tips on being a good interviewer, like right now?
I think when you interview people, again, you got to know a little bit of their background properly. You got to make sure that you don't ask questions that embarrass them. You want to draw out what you really want from that particular person, the theme that you want to draw from that particular person, and make sure you go through that scheme and not something else that will embarrass him. I think that's very, very important. I think an interview for example, politics and an interview for lifestyle is entirely different. In lifestyle, you really want to take the best out of that person to get a direction.
Now, I'll ask more like thought-provoking questions. So, what is your life motto?
My life motto? You probably ask me, would I do the same thing if I'm going to live again? Yeah, I think I would do the same thing. Although I always believe that medicine is too narrow. And that's why I always, whenever I talk to medical students, young doctors, I said, you got to be more broad-minded. Don't just look at medicine, because you are treating not just disease, you're treating this patient. Second, there's a lot of problems in health. It's to do with society. So if you understand the society more, you understand people's lifestyle more, and if you really look for the person, not just for his disease, then you're going to produce a better doctor. Furthermore, as I started off by saying, doctors are a very good position to understand the society. Because if somebody can entrust their life on you, telling you everything, why they're sick and what happened to them, and I'm going to die or not, they will end up telling you everything about life. And it's through that you're going to learn more about life, the society, and how to improve it.
Right. So what do you enjoy doing now? Like, what makes you happy?
Interviewing by you.
Thank you.
I think that's very interesting. I enjoy that, yes. No, I believe one of the good things about myself is that my work and my pleasure is the same thing. So I don't find working as a chore. I find working as part of my interests. And the main thing is because by working, I understand people.
I see. So this is my very last question.
Okay.
You actually predicted the one that is like, oh, if you could go back to your 20s, like, how would you plan out your career path? It's the same, right? Like you would have done the same thing.
Yeah, I would do the same thing. I mean, yes, I would not stay purely as a doctor or a surgeon. I would definitely broaden myself and then the society.
So this is my final question.
This is your last one.
Yeah.
This is your third final, fourth final question.
What advice would you give to current medical students and aspiring healthcare professionals?
Well, I think two things. First of all is that you really have to be good in your profession. And when I say good in profession, you really got to learn not just the disease itself, but the person carrying the disease. I think that's very important because, I mean, you see, you look at the patient. A lot of times the patient has a cancer. If you just concentrating what the cancer is all about, how long it's going to live, it's not going to help the patient. You're going to help. You don't look at the person and explain to him, okay, you got this, but don't worry, you can have all these done for you, and what are the effects and all this sort of thing. The patient will be more calm after this event. So that's something I want to learn. Secondly, I still always believe that do not be so close-minded to look at just the disease. Look at the society. Because you really should be broad-minded enough to know what the society is all about. I hate to hear the doctors who only know nothing about the world, nothing about Donald Trump and Zelensky. I don't mean you need to be expert in that, but you have to know what is happening. But know what is happening, you know what is going to happen in Gaza, you know what's happening in Ukraine, and therefore your mind gets involved in that and say how you help the people.
Yeah, it's really important to be like aware of the surroundings.
Yeah.
Also,
you'll be aware of the surrounding. You realize that there are people who live in, Tong Fong. There are people who live in other places. You realize that there are people who are elderly who still goes around every single day to collect boxes to sell it for them. And yet these people feel that, look, I don't want government support. I can earn my living by just selling, cardboard boxes. They're fantastic.
Thank you so much for today.
It's my pleasure too. Yes.
Yeah, yes. I feel so lucky to have this opportunity, and it was so fun, like talking to you today.
Thank you very much.
Yeah.
Yes.
Thank
yes.
you.
Thank you.
Yeah.